Hi, welcome back to Tuesdays with Timeless. I'm Dr. Stephanie Christian. Today I'm going to talk about injections around the mouth. What areas am I talking about? Well, I'm talking about the lips and the vertical lip lines that come into the lips, the corners of the mouth, which are called the oral commissures. I'm talking about the areas under the corners of the mouth, which are called the puppet lines or the marionette lines. I'm talking about the crease on the chin. I'm talking about that orange peel skin that happens on the chin, sort of a witchy chin. I'm talking about the pre-jowl sulcus, which prevents that jawline from being smooth here. I'm also going to talk about the DAO muscles, which are right in here, and they're responsible for turning the corners of the mouth down. I'm going to talk about some muscles right up here that are responsible for, if they're too strong, for pulling these muscles up so that when some people smile, the lips aren't at the top of the teeth, they're pulled too high and they get a gummy smile. When we are young, a youthful area around here has some characteristics. First, the lips. The lips themselves are plump. They may not be really full, but they are plump, and the skin overlying the lips is smooth. They don't have wrinkles. The skin around the lips is also smooth. And when we look at the lips in relationship to one another, the bottom one is more full. The lips have a line that goes up from the peak on the top lips called the philtrum column on each side, and that holds that peak on the top each side up so that it maintains that peak. And there's a little concavity between that peak, and that forms the Cupid's bow. The edge of the lip is very distinct, where the red meets the skin color, and that's called the vermilion border. The center part of the lower lip, between the edge of the nose and the edge of the nose, is where you have the most sort of pillowiness of the bottom lip. The corners of the lips, the oral commissures, are well supported. So they don't cave in. As I said, the skin is smooth and the jawline is smooth. As we age, we don't produce as much collagen. So the lips start to lose volume. The bottom lip is not as pillowy, and it starts to develop creases in the lip itself. The top lip similarly has a loss of volume, and it develops creases. But the philtrum columns on each side get thinner and thinner and eventually go away. They lose their support of the peaks, so the peaks drop and the lip flattens. Eventually we get to the point when we smile that the upper lip curls under and disappears. A lot of people develop these vertical lip lines. They are most common in Caucasian people who've had a lot of sun damage. They are also common in smoker's line, and they are frequently called smoker's lines, but less than half of people who have them are actually smokers or ever were smokers. The other people who get them are people who have repetitive motion. They have little tics that they do. They move their mouths from side to side, or they crease or purse their lips when they're concentrating, or they whistle a lot, or they drink from a straw, or they drink from one of those water bottles that has a little nipple at the top. So they are pursing their lips a lot. There are also some people who speak in such a way that their mouths purse when they speak. There are a lot of people like myself who, when we speak, we pull our mouths wide, but for people who purse a lot, they're pursing their mouths thousands, maybe tens of thousands of times a day. Well, we have various injections that we can do that are going to change it. You can't replace lost volume with plastic surgery. Plastic surgery will pull things tight, but they're not going to do anything about the lost volume in the lips or the lost volume in the pre-gel sulcus or the lost volume here, or the fact that when you smile, you have a gummy lip, or the fact that you have these creases. A facelift is not going to do anything about the creases around the mouth. So what are these injections that we do? So I'm going to start with the lips. We use hyaluronic acid in the lips. Hyaluronic acid, as I've mentioned in other videos, is a naturally occurring product in the body. It's made synthetically for injections. It's soft, but it is reabsorbed by the body over time. And we have a number of different formulations depending on where we plan to inject it and depending on what effect we want. I'm going to use a different one for a 29-year-old who wants lip augmentation than I'm going to use in a 65-year-old who simply wants a little bit of volume replacement and wants her lips smoothed. I also use it in the creases themselves in someone who has developed creases that are not just there because of puckering. Sometimes creases that are there just because of puckering are eliminated by replacing the volume in the lip. Think of material. If you have the same amount of material here, but you've lost volume in the lips, so that material is going to pucker. If I replace the volume in the lips, those lines are going to go away. But if you add sun damage to that and you add maybe some smoking or exposure to secondhand smoke, then you're going to have creases that have to be filled. So then I inject into those creases themselves. I also use hyaluronic acid filler here in the corners, down here to build up where the lost volume was. I can do it here in this crease. I actually use Radiesse, the same one that I use in the cheeks, in the pre-gel sulcus. Now, neuromodulators. I can use either Botox or Xeomin for people who have unconscious movements of their mouth. They aren't aware of them. I can't say, I need you to stop that movement, because they aren't aware of it. But if I put just the tiniest little bit of Botox or Xeomin around the lip, that's often enough to stop them from doing that movement. We do it a few times and that will often just stop that movement. For people who have a gummy smile, these muscles right here are overactive. And if we soften those muscles, it will drop the lips so that when they smile, the lip is at the top of those teeth. It's just a tiny bit. It's not very much. We don't want to paralyze those muscles because you use these muscles and having the lip move is important. So it's just a tiny little bit. The other place we use the neuromodulators is in the DAOs. Depressor, pull down, angularis, the angle oris of the mouth. So these muscles pull down the angle of the mouth. And for people who have super strong muscles there is a good chance that injecting either Botox or Xeomin into those muscles will actually turn a comma there into a dash. So that's what the injections are. And how do we approach this? Well, as I say over and over and over again, when it comes to the face, there's nothing more beautiful than healthy skin. So everyone over 35, no, almost everyone over 35, gets recommended to either start retinaldehyde or tretinoin, depending on what other skin conditions they have. And most people need to hydrate their skin. Even if you have acne and really oily skin, you may need to hydrate your skin. Don't confuse oil with hydration. And then everyone, absolutely everyone, needs to use a zinc-based sunscreen every day, forever, from hairline to nipple line. And these are the basics of skincare. And then depending on what your particular skin concerns are, then we add into that. So that's skincare. And then, depending on where we're injecting, we may put you on an anti-bruising protocol, and that starts 1 to 2 weeks before we inject, especially if we're going to be injecting right here, because this is an area that bruises frequently. And then we have you put ice on the area wherever we're going to inject. If we're injecting into the lips, there's a lot of sensory nerve endings, including right above the lip. So we use topical numbing and then Pronox. Pronox, I've talked about this in other videos. It's self-administered nitrous oxide. And so you breathe it, and it gives you not only analgesia, but also it's an anxiolytic. So it decreases your nervousness, and by taking away some of the anxiety, you tend to relax, which also decreases perception of pain, as well as taking away the pain. It's completely safe. It's out of your system in 10 minutes, and so you're safe to drive yourself home. And what are the results? Well, this is not going to take you back to being 10, and I listen very carefully to patients, to what it is that you're trying to do. I really like to see a picture of what you looked like somewhere between 14 and 18. Ideally, I would like to see a picture of you not smiling, so I can see your lips in their neutral shape. And then I listen to you. What is it that you're trying to accomplish? My goal is to have you look like your best you, to look refreshed and natural. But I also want to hear what is your goal. You'll be swelling for a little while. So I want you to stay away from salty foods and beverages that have added sugar, and processed foods. And because your lips will be numb at first, you need to stay away from any hot beverages. To your eyes, you'll be swollen a little longer than you are to anyone else's eyes, because we are our own worst critics. But to someone else's eyes, you'll be swollen for about 36 hours. After that, don't do this. There's nothing worse than doing this, because people want to see what's behind your hand. Don't draw attention to it. Wear a neutral lipstick on a Zoom call, and no one will be looking at your mouth. They're looking at your eyes. That's where you show your intellect, your humor, and your interest in the people with whom you're communicating. I hope this answered any questions you have about injections in this general area of the face. It is definitely an area of the face that ages us. And it's an area that I get more and more questions about, because people are spending so much time on Zoom these days. If you have additional questions, please comment below. I love that interaction. So enjoy your next week, stay well, and I'll see you then.